Madam Chair, I certainly do want to make some opening remarks, and I echo everything you've just said. I want to thank our residents. I want to thank the great employees of Miami-Dade County as we face this unprecedented challenge. Again, good morning, Chairwoman and Commissioners. Our world really has changed dramatically since the last meeting of our full board of county commissioners back on March 3rd. Just March 3rd, unbelievable. 2 weeks before, on March 18th, I met with Dr. Villalta and her team at the State Health Department to better understand the spread of this coronavirus and how to better prepare and to protect our residents. We started immediately with a plan to protect the highest risk group, our senior citizens. I put Deputy Mayor Kemp in charge of this effort. He's done a fabulous, tremendous job. I met with the mayors, city managers, and school superintendents to start sharing information. Looking back at this now, I would say that one of the reasons we're not seeing these high hospitalization rates here compared to other areas that have had less testing may well be that we started very early to try to protect those over the age of 65 and those with serious health conditions like cardiovascular disease, COPD, and diabetes. So here we are today in a virtual meeting of the Board of County Commissioners, and we have spent 2 months focused on this pandemic. I know that we all want to get past this health crisis and get our community working again and enjoying all that our county has to offer. But to get there, we will need some discipline from everyone in our community to follow the health guidelines and to stay safer at home and practice social distancing. So let me go over a general timeline of the emergency orders that we've issued. I signed a state of emergency in Miami-Dade on March 11th upon returning from Washington. I'd actually had asked them to do that while I was in Washington, but I could not sign it until I got back. And so as soon as I got off that plane, I signed a declaration of emergency here on March 11th. Since March 16th, I've issued 19 executive orders and 8 amendments, setting protocols for health and safety in our county during this growing pandemic. March 16th, I ordered the closure of congregate meal sites and community centers to protect our elderly, and I think we were one of the first in the country to do that. On March 17th, I ordered all restaurants, theaters, and other gathering places to close outright. Only restaurant kitchens could remain open for takeout and delivery. March 18th, banned the gatherings of more than 10 people in Miami-Dade operated parks, beaches, and recreation facilities. I also ordered common use rental scooters, mopeds, and bicycles to be removed from public streets. March 19th, all parks, beaches, and recreational facilities countywide, whether operated by the county or not, were ordered closed. I also ordered that all non-essential retail and commercial establishments close their doors by 9 o'clock on March 19th. March 21st, we ordered the prohibition of boats rafting up to have parties out in the water. That same day, Emergency Order 920 also shut down hotels, motels, short-term rentals, except for the use by essential lodgers and emergency personnel. On March 21st, I also amended Executive Order 620 to close all marinas and boat launches because it became rather clear that people weren't practicing social distancing or keeping the groups of less than 10. It's an order I really didn't want to do, but unfortunately, people weren't listening. On March 24th, I signed an order to keep all streets and public areas to no more than 10 people, a gathering of no more than 10 people, and MDPD went out and enforced to make sure people were abiding by that order. March 25th, signed another order urging anyone over 65 years old to stay home and those who have a serious underlying condition that can be worsened by COVID-19. March 26th, we tied up all those orders into one protocol, now known as Safer at Home. And this happened thanks to collaboration with Miami-Dade League of Cities and officials in Broward, Palm Beach, and Monroe counties. On March 27th, ordered all essential businesses to have spacing in place so that their patrons could practice social distancing. Miami-Dade County Police continues to enforce this order and will shut down businesses that do not abide by it. On the 28th of March, the county suspended building code inspection services, consistent with public health and safety with certain exceptions to allow for the continuation of construction projects. On the 31st of March, I ordered the closure of pools and hot tubs and fitness centers at condos, apartments, and other non-commercial establishments. That same day, we ordered all adult daycares closed by April 3rd. We're working with the staffs of those centers to make sure anyone needing a meal or services continue to get those services. It took a long time for us to get to that point with adult daycare. That was a very difficult logistical problem, and to be able for us to get to close those centers. On the 1st of April, Florida Governor Ron DeSantis issued a safer at-home executive order statewide, modeling after Miami-Dade's order. Matter of fact, he even references it. On April the 2nd, I ordered that all essential retailers limit their food supply to packaged foods and close salad bars. I also ordered the maximum capacity of those stores to 50% or less. On the 4th of April, ordered all hospitals in Miami-Dade County to report their current inventory of beds and ventilators, among many other statistics. Also on April 4th, we followed new CDC recommendations about cloth face coverings, and I issued that order. We are in truly uncharted territory with COVID-19, so developing these protocols has felt like really taking off the runway at full throttle, and we're still trying to build the plane. We've had to keep refining our strategy every single day. Every emergency order and amendment was based on recommendations from the Centers for Disease Control and Prevention and information from our state health experts and local leaders on the ground in our neighborhoods. Every time I issued a new order, we would learn more about the spread of this virus and a new problem would come up. We live in a beautiful place, and our residents naturally like to socialize in our tourist mecca. There were problem spots at first. People were partying on boats, milling around too closely at restaurant pickup windows and the like. So we had to get tougher on those who weren't following the social distancing rules. There was a lot of confusion because some counties, like Miami-Dade, were doing more to protect people from the virus. Others weren't. They weren't there yet. And some cities were also issuing orders that fit their particular needs but weren't needed countywide. I reached out to the Miami-Dade County League of Cities as well as the county managers of Broward, Palm Beach, and Monroe counties to exchange ideas so that we could be as proactive as possible to stop the spread of COVID-19 throughout South Florida and be as consistent as possible. We all agreed on a unifying protocol, safer at home, and that's the protocol that we've been using and the terminology that we've been using ever since. And the governor has since taken up that message statewide. I realize that these orders have been hard on our businesses and workers, but our community's health comes first. Right now, we're focusing on how to help small businesses get their fair share of the Federal CARES Act and how to help our unemployed workers file for benefits with the state. We already have various hotlines and programs in place, which I can talk about more later. Some of these things will actually be opening up tomorrow. One issue that I'll be getting asked about are curfews. Cities have the right to impose those curfews if that's what they think is required. It's not needed in Miami-Dade County, however. I speak every single day with the police director, and Police Director Ramirez and the Florida Department of Health have advised me that these restrictions are not necessary for the unincorporated areas. And also, things are quieter in our neighborhoods at night, and we don't want to spread our police force too thin, as they likely will have more demands on them in the weeks ahead. Miami-Dade Police Department has been enforcing social distancing orders at essential businesses like grocery stores, pharmacies, and construction sites. We will close businesses if they violate the order. We now have many more testing sites than just 2 weeks ago and continue to expand them now that the testing kits are arriving more quickly. I continue to monitor what's happening in our hospitals, the number of beds, intensive care beds, and ventilators available to make sure we are prepared for the worst. I want to, the thing with the hospitals and why we're so focused on that is that a lot of people are focused on the number of positive testing results that we get in Miami-Dade. Really, the most important part is how many of the people that are sick in this county with COVID-19 are going to the hospital. That's why we keep tabs on those hospital beds. To help us keep moving quickly to flatten the curve, we have created a public-private research collaboration with the University of Miami. This investigation project began this week. We are doing random testing reflective of our county's diversity in age, gender, ethnicity, race, and other demographic factors, including geographic location. This will help us pinpoint areas of higher transmission and vulnerable subpopulations. I want to stress that this fingerprint blood test is going to take several weeks as we test 750 new people each week for antibodies to this virus. The testing strictly adheres to HIPAA standards, so volunteers can rest assured that information about their health is kept confidential. Now, this is not a definitive test on the virus, and you just can't simply walk up and ask for it. It's a scientifically created sample that will help us plan our response to this virus in the future. And it's actually one of the few done around the world. In addition, One of the latest orders establishes twice daily reporting on the availability of beds and supplies in all of our hospitals, along with the numbers of patients that we have who are receiving critical care, and are also on the other side, the ones that are being discharged each day after recovering from COVID-19. All this data will give us a very clear understanding of our supply chain, along with our need for medical staffing and first responders. While we still have a long road ahead of us in our fight against COVID-19, we are already working hard on a recovery plan to ensure that businesses and residents thrive moving forward. To help our small businesses, we have partnered with the Beacon Council and the Greater Miami Chamber of Commerce. We held a virtual town hall last week, attended more than 1,000 people and business people. We have launched a full range of resources on miamidade.gov/coronavirus that are listed under the Business Assistance button. That site offers tools explaining the new federal CARES Act, which provides much needed economic support to small businesses dealing with the challenges of COVID-19. This county site includes local hotlines and email addresses to help businesses apply for financial relief offered by the federal CARES Act. These are forgivable loans that convert into grants a year from now if the funds are used as they are intended, which is to meet employee payroll during the difficult 2 months ahead. Starting tomorrow, we'll be handing out unemployment applications at 26 Miami-Dade County libraries. This will help people who either don't have computers at home to file their claims or who have had real difficulties accessing the state's overburdened online system. We are printing hundreds of thousands of these claim forms, which we'll be handing out along with envelopes so people can fill out these forms safely at home and then return that confidential information to our library sites. Every evening, boxes with the forms will be escorted by police to Career Source South Florida offices where trained staff will send the applications overnight to the state to expedite the processing of those unemployment claims. While we battle COVID-19 on all these fronts, I keep stressing the fact that health is our top concern. Our airports and seaport continues to serve an important health and safety function by moving food and medicines into our county and also out into the rest of the nation. We're also serving a humanitarian need of getting Americans back to their cities and towns and moving foreign visitors back to their home countries, and also allowing our own residents to come back home. I want to stress just how valuable this work at MIA and Port Miami is during these tough times. Finally, my most recent executive order was 1920, issued on Saturday. It encourages people to follow CDC guidelines by wearing facial coverings if they have to go out to get food or medicine from essential businesses. While wearing masks can help us stay safe during these close encounters in essential stores that can't be avoided, everyone needs to remember that masks also can give you a false sense of security. So you will need to keep, you'll hear me continue to say, practice social distancing, and finally, you're safer at home. Again, thank you, commissioners. I'm open to answer any questions. I also want to thank you for the support during this time. It's been really, really difficult, and I know that we work together very well. It's also great to have you in on our daily briefings that we have every morning. And again, I too share, Chairwoman, I share you in that, we're all in it together, and we're all going to get out of this together. And again, it's been a privilege serving the people of Miami-Dade County. And I also want to thank all of our employees, our fantastic employees that are doing an unbelievable job during this really unprecedented crisis.